Hi everyone. Today we'll learn about missed miscarriage. Last time we have seen threatened, inevitable, complete, incomplete. So today we'll discuss missed miscarriage. In that we are going to see about definition, clinical features and management. First we'll see definition. When the fetus is dead or retained inside uterus for a variable period is called missed miscarriage or early fetal demise. So, when the fetus is dead and retained inside the uterus. In incomplete, what happened? Conception material will come out, some will retain inside the uterus. That is incomplete abortion. But here in the missed, what happened? Total fetus will be dead and will be inside for variable period. So that is called missed miscarriage or early fetal demise, or you can call it as silent miscarriage. This is about the definition. Next we'll see clinical features. Here we can see persistent or brownish vaginal discharge due to dead fetus in the uterus for variable period. That's what the blood will be, vaginal discharge will be brownish color, and retrogression of breast changes. So here during the pregnancy, breast will be changing. Montgomery tubercles will come, primary areola, secondary areola will form. So here breast changes will occur here. It goes to the non-pregnant stage. Retrogression, that means back to the stage. And cessation of uterine growth. So cessation of uterine growth, as earlier I said that till umbilical cord, if uterine growth goes till umbilicus of the woman, that is 24th week. Suppose in 30th week also the uterine growth is only at the umbilicus. So that means uterine growth has been stopped. Here also in missed miscarriage, the fetal growth will be stopped due to dead fetus. It will not grow because the fetus has been dead. That is cessation of uterine growth. Next, non-audibility of fetal heart rate. Can't hear fetal heart rate due to dead fetus. And immunological test for pregnancy will come negative because fetal has been dead inside the uterus. And if finally if we go for ultrasonography, it reveals that empty sac in the uterus. You can find out by these clinical features there is a missed miscarriage. You can diagnose finally it is a missed miscarriage. Next we'll see complication. So if the fetus is dead inside the uterus, so there might be a chances of infection for variable period. The pregnant woman doesn't know she had missed miscarriage, and it may lead to blood coagulation disorders. If it is ignored, then it may transform into malignancy also, malignant transformation. So these are the complications. Next we'll see management. Here management, uterus less than 12 weeks, that means 3 months, below 3 months and above 3 months. So first we'll see uterus less than 12 weeks. So here we'll be giving medical management. So what kind of medical management will be given? If dead fetus is inside the uterus, we need to remove that fetus. So here first we will follow the medical method. If it is not expelled out, then we can go for surgical method. So in medical methods, first we'll give misoprostol, that is a prostaglandin, 800 microgram vaginally should be inserted and repeated after 24 hours. Until 24 hours, whatever fetus is there, it will be expelled out automatically. If not, we have to repeat. So usually in 48 hours, the fetus will be expelled out from the uterus. Next, if it is not if did not came after 48 hours also after giving misoprostol, then we can go for suction evacuation. So here for removing this fetus we have to go for suction evacuation. In this there might be a chance of uterine wall damage and chance of brisk hemorrhage, so should be very careful. So this is about the uterus less than 12 weeks. Next we'll see uterus more than 12 weeks. Here we'll be giving first misoprostol 200 micrograms into the inserted into the posterior vaginal fornix. So every 4 hours we need to give misoprostol. If the fetus comes out, okay. If does not come, then we have to go for oxytocin drip. That is 10 to 20 units in 500 ml normal saline. So that should be given 30 drops per minute. So even though if it is not expelled out, then we have to go surgical. That is dilatation and evacuation. So we need to remove through dilatation and evacuation by giving prostaglandins also. See here cervix should become dilated, like soft. Cervix should be soft. For that softening of cervix we need to give prostaglandin. So by giving that we have to do dilatation and evacuation. So this is the treatment management will be done for the miscarriage. Hope you people have understood. If you have any kinds of doubt, you can contact me.